Comparative effectiveness research is of interest to many payers of pharmacy benefits these days because they're very involved in determining what their coverage policies are at very refined levels. They're very involved in developing management processes that can affect efficiencies and effectiveness in their benefits, so they need as much information as they can to bring precision to their benefit. And in particular, they're interested in comparative informations. When there are more than one choice, they want to make the right choice. And they're particularly interested in effectiveness information. It's whether things work or not that they're interested in, and that comes more from effectiveness research. So that's a particularly interesting aspect to them. To do CER within a benefit plan, you have to take into account that you're doing it within a benefit plan. And so there are various rules of a benefit plan. There are various implications, like it's hard to randomize within a benefit because many benefit members will see or perceive it as a different benefit for different people in their health plan. And so it makes it difficult to randomize in the classic sense. The types of information that payers respond to and are interested in also have an impact on how to do CER in the benefit. They want certain types of effectiveness parameters, certain kinds of health economic outcomes data is what they're interested in. So all those have to be taken into account when CER is done within pharmacy benefits. CER can be used in a lot of parts of a benefit, actually from elements involved with just coverage policy, when a payer decides what should be covered, knowing the level of effectiveness, comparing it with other technologies are all important. And so just in coverage alone it's important. They're interested in using it for their clinical programming, the management of their programs. They want to be able to put effective tools into place. They want to be able to affect certain utilization patterns, and comparative effectiveness information is going to drive those decisions. I think what's interesting now in CER in the pharmacy benefits area is the level of interest of the payer community, a level of interest where they're actively participating in the research itself. They're just not sitting back waiting for it to be delivered. They are participating. We have had so much participation in our client base with the various studies that we've been doing that we've actually created the Medco Research Consortium, where we've been able to bring together a large group of plans, over 100 of them, that represent over 40 million covered lives, who have said that when we are planning a research study to please talk to them because they would probably like to be interested in it. So I think what we may be seeing is the start of a new research institution in this country, more or less. We have the academic and government institution that does their research. We have the manufacturing industries that do their research, and I think we may be seeing the beginnings of an institute of some sort, of some shape in the payer community that will drive research to get the types of information they need to make the decisions they have to make.